In this lecture, we're gonna cover pain and analgesics. At the end of this lecture, you'll be able to learn the physiology of pain, roles of prostaglandins and COX enzymes in the etiology of pain and inflammation, role of prostaglandins in the regulation of organ functions, and analgesics, the narcotics, opiates and non-opiates, and non-narcotics, NSAIDs, and aminophenol.
First is what is pain. Pain is a common symptom and it's important because it's both signals disease in the broadest sense and its diagnosis, irrespective of the cause. It's real life in one of the most important diseases of a doctor.
Basically, noxious signals send impulses to the spinal cord, which relays the information to the brain. The brain interprets the informations of pain, localizes it, and sends back instructions for the body to react. Pain sensation is mediated by pain receptor or nociceptor. It is a sensory receptor of the peripheral somatosensory nervous system that transmits noxious stimuli to CNS, which are present in our skin, superficial tissues, and virtually all organs except to the brain. These receptors are essentially the nerve ending of so-called first-order neurons in a pain pathway. The axons of these neurons can be myelinated A-type or unmyelinated C-type.
Myelinated A fibers conduct at fast speed and are responsible for the initial sharpening process at the time of injury. In myelinated C, fibers conduct at slower and are responsible for longer lasting diffusing pain.
The roles of prostaglandins and COX enzymes in the etiology of pain and inflammation. Prostaglandins are lipid octanoids derived from arachidonic acid. They both sustain homeostatic functions and mediate pathogenic mechanisms, including the inflammatory response. They are generated from arachidonate by the action of cyclooxygenase or COX isoenzymes, and their biosynthesis is blocked by nonsteroidal anti-inflammatory drugs NSAIDs, including those selective for inhibition of COX-2. Despite the clinical efficacy of NSAIDs, prostaglandins may function in both the promotion and resolution of inflammation. So, the role of prostaglandins in the regulation of organ functions. The prostaglandins are a group of lipids made at sites of tissue damage or infection that are involved in dealing with the injury and illness. They control processes such as inflammation, blood flow, the formation of blood clots, and the induction of labor. Prostaglandins act as signals to control several different processes depending on the part of the body in which they are made. Prostaglandins are made at sites of tissue damage or infection where they cause inflammation, pain, and fever as part of the healing process. When a blood vessel is injured, a prostaglandin called thromboxane that stimulates the formation of a blood clot to try to heal the damage. It also causes the muscle in the blood vessel wall to contract, causing the blood vessel to narrow to try to prevent blood loss.
So now we'll be talking about opioid analgesics. So there are three types of opioid receptors, namely mu, delta, and kappa. They all belong to the G protein coupled receptor family, and mu is the most important. So the mu effects are the following. supraspinal and spinal anesthesia, in which delta and kappa also has that effect. And then we have here sedation, inhibition of respiration, slowed GI transit, modulation of hormone, physical dependence, and euphoria. Their effects are somewhat similar, but the kappa has cytomimetic effects, in which the other two does not have. So, the role of opioids in the pain involvement is that opioids bind to and activate opioid receptors on cells located in many areas of the brain, spinal cord, and other organs in the body, especially those involved in feelings of pain and pleasure. So, how opioid agonists induce analgesia? The most effective clinically used drugs for producing temporary analgesia and relief from pain are the opioid family, which includes morphine and heroin. There are no currently other effective pain therapeutic alternatives to opiates. Several side effects resulting from opiate use include tolerance and drug dependence or addiction. In general, these drugs modulate the incoming pain information in the spinal and central sites, as well as relieve pain temporarily, and are also known as opiate-producing analgesia. Opioid agonists bind to G-protein coupled receptors to cause cellular hyperpolarization. Most clinical relevant opioid analgesics bind to MOP receptors in the central and peripheral nervous system in an agonist manner to elicit analgesia. So, major classes of opioid analgesics. So, we have here morphine. So, morphine is used to relieve moderate to severe pain. Its MOA is that it relieves both the perception of pain and the emotional response to it. The contraindications of morphine are hypersensitivity, some products that contain tartrazine, bisulfites, or alcohol and should be avoided in patients with known hypersensitivity. Its adverse effects is that overdose leads to coma, and its minor adverse effects are constipation, nausea, and vomiting. So we have here diamorphine, or also known as heroin. It is used in particular to treat pain after a surgical operation and pain caused by cancer. It may also be used following a heart attack or for breathlessness caused by fluid in the lungs. Its MOA is that when it is administered orally, diamorphine experiences extensive first-pass metabolism by way of deacetylation to generate the active metabolites and morphine. Its adverse effects are sedation, nausea and vomiting, constipation, and sweating. Diamorphine should be given in reduced doses or with caution to patients with asthma or decreased respiratory reserve, and avoid using diamorphine during an acute asthma attack. So we have here fentanyl. Fentanyl is used to treat severe pain or as an adjunct to anesthesia. Its MOA is that fentanyl binds to opioid receptors, especially the mu-opioid receptor, which are coupled to G proteins. Its contraindications is that the use of fentanyl is contraindicated in patients in the following situations: after operative interventions in the biliary tract, as this may slow hepatic elimination of the drug; patients with respiratory depression, with liver failure, with known intolerance to fentanyl, and with known hypersensitivity. Its adverse effects includes euphoria, confusion, respiratory depression, drowsiness, nausea, visual disturbances, and many others. We have here codeine. Codeine is used to treat pain. And also, it is used for long-standing pain when everyday painkillers won't work. It is also used to treat diarrhea. Its MOA is that codeine is an opioid and an agonist of the mu opioid receptor. It acts on the central nervous system to have an analgesic effect. It is metabolized in the liver to produce morphine, which is 10 times more potent against the mu receptor. Its adverse effects include drowsiness, lightheadedness, dizziness, sedation, shortness of breath, nausea, vomiting, sweating, and constipation. Contraindications include hypersensitivity, patients with respiratory depression, and codeine is not allowed for children less than 12 years of age and for those pediatric patients with a history of tonsillectomy or adenoidectomy. So, what causes opioid addiction? Opioid drugs alter your brain by creating artificial endorphins. Besides blocking pain, these endorphins make you feel good. Too much opioid use can cause your brain to rely on these artificial endorphins. Once your brain does this, it can even stop producing its own endorphins. The longer you use opioids, the more likely this is to happen. You will also need more opioids over time because of drug tolerance. Other signs of symptoms of opioid abuse include poor coordination, drowsiness, shallow or slow breathing rate, nausea, vomiting, constipation, physical agitation, and poor decision making. So we will be talking about non-opioids now. So we have here paracetamol. We commonly use paracetamol to reduce our high temperature of fever. Well, paracetamol is also a painkiller that is used to treat aches and pain. Its MOA is that it is poorly bound to plasma proteins and is partially metabolized by hepatic microsomal enzymes to the inactive sulfate and glucuronide. Its adverse effects include dizziness, excitement, and disorientation. It is contraindicated to patients with caloric undernutrition, acute liver failure, liver problems, severe renal impairment, and many others. We have here aspirin. It is used to reduce fever and relieve mild to moderate pain from conditions such as muscle aches, toothaches, common cold, and headaches. It may also be used to reduce pain and swelling in conditions such as arthritis. Its MOA is that it is used to address these nerve signals chemically by blocking the effects of certain enzymes that create prostaglandins. Its adverse effects include rash, gastrointestinal ulcerations, abdominal pain, upset stomach, heartburn, and cramping. It is contraindicated to patients with systemic mastocytosis, low vitamin K levels, gout, and anemia.
So now, I'll give you some examples of non-narcotics drugs, and I'll be explaining their indications, mechanism of action, clinical effects, adverse effects, and contraindications of the different types of NSAIDs for the management of pain. So first is, what is non-narcotics? Non-narcotic analgesics are medication that is used to control pain and inflammation. They are available at drugstores without a prescription or by prescription when given a higher doses. Some types of these medications can be given during surgery to reduce post-surgical pain and lessen the need for narcotics. So here are the examples of some non-narcotic drugs. First is the aspirin with a aspirin and Ecotrin brand name, the paracetamol, Calpol, and Tylenol, diclofenac, the Diflac, piroxicam, Feldin, the ibuprofen or the Advil, and lastly is the ketoprofen Fastum. So first is aspirin. Aspirin or the acetylsalicylic acid in the regular tablet form is indicated to relieve pain, fever, and inflammation associated with many conditions such as the flu, common cold, neck and back pain, dysmenorrhea, headache, tooth pain, sprains, fractures, myositis, neuralgia, synovitis, arthritis, bursitis, burns, and various injuries. Its mechanism of action inhibits prostaglandin biosynthesis irreversibly, acylating a serine residue in the active site of cyclooxygenase or the COX. There are two main isoforms, the COX1 and COX2. The COX1 or the cyclooxygenase 1 is a constitutive enzyme which is present in platelets and other cells under basal conditions, while the COX2 is an inducible form which is produced in response to cytokine stimulation in areas of inflammation and produces large amounts of prostaglandins. Its clinical effect is that it disrupts the production of prostaglandins throughout the body by targeting the cyclooxygenase 1 or COX1 and the COX2. The adverse effects and contraindications of aspirin includes salicylism. It is a toxic doses of salicylates including aspirin that cause tinnitus, deafness, nausea, vomiting, abdominal pain, and flushing and fever. Next is the dyspepsia. It is as common as is mild gastric blood loss. Severe blood loss from the stomach can be life-threatening. Next is the aspirin-sensitive asthma that occurs in approximately 5% of asthmatics. It is associated with nasal polyps. And then the last is the Reye syndrome, a rare disease of children with high mortality and is characterized by hepatic failure and encephalopathy often occur in the setting of viral illness. So now I'll be sharing you the concept of the different indications of aspirin based on its dose. So here in the screen, you can see that it has an oral routes of administration. So first is for the primary prevention, loading from 150 to 300 milligram for acute ischemic stroke, angina pectoris, and myocardial infarction. Next is initially 300 to 900 milligrams, repeatedly 4 to 6 hourly according to clinical needs. It has a maximum of 4 grams daily. For fever and mild to moderate pain, it is still routes of oral administration. Next is for rheumatic disorders, which has for adult 4 to 8 grams daily in divided doses for acute disorders and 5.4 grams daily in divided doses for chronic conditions. Next is for prophylaxis of cardiovascular events in high-risk patients. For long term, it is from 75 to 150 milligrams once daily, and for short term, from 150 to 300 milligrams daily. And the last is, it has a rectal routes of administration, which is for fever and mild to moderate pain for adults, as suppository ranging from 450 to 900 milligrams for hourly, and its maximum is 3.6 grams daily. So the next non-narcotic drug example is the paracetamol. It is an acetaminophen that is also commonly known as Tylenol, the most commonly taken analgesic worldwide, and is recommended as first-line therapy in pain conditions by the World Health Organization. It is also used for its antipyretic effects, helping to reduce fever. Its mechanism of action inhibits prostaglandin biosynthesis under some circumstances, for example, the fever, but not others. The difference from other NSAIDs is still under investigation. Animal and clinical studies have determined that acetaminophen has both antipyretic and analgesic effect. Its adverse effect and contraindication of paracetamol, the most important toxic effect is hepatic necrosis that leads to liver failure after overdose. But renal failure in the absence of liver failure has also been reported after overdose. There is no convincing evidence that paracetamol causes chronic liver disease when used regularly in the therapeutic dose. So the next drug is the diclofenac. Like other NSAIDs, it is often used as first-line therapy for acute and chronic pain and inflammation from a variety of causes. Its mechanism of action inhibits cyclooxygenase 1 and 2, the enzymes that is responsible for production of prostaglandin, which is the precursor to other PGs. These molecules have broad activity in pain and inflammation, and the inhibition of their production is the common mechanism linking each effect of diclofenac. Its clinical effect: the diclofenac reduces inflammation and by extension reduces nociceptive pain and combats fever. Its adverse effect and contraindication: the hypersensitivity to diclofenac or other NSAIDs, aspirin-sensitive asthma, risk factors for volume depletion, and moderate to severe heart failure, ischemic heart disease, and pregnancy which is in the third trimester. Next is ibuprofen. Ibuprofen is the most commonly used and prescribed NSAID, and it's very common over-the-counter medication widely used as an analgesic and anti-inflammatory and antipyretic. The use of ibuprofen and its enantiomer deoxybuprofen in a racemic mix is common for the management of mild to moderate pain related to dysmenorrhea, headache, migraine, postoperative dental pain, spondylitis, osteoarthritis, rheumatoid arthritis, and soft tissue disorder. Its mechanism of action: the exact mechanism of action of ibuprofen is unknown. However, ibuprofen is considered an NSAID, and thus it is a non-selective inhibitor of cyclooxygenase, which is an enzyme involved in prostaglandin, mediators of pain and fever, and thromboxane, the stimulators of blood clotting synthesis via the arachidonic acid pathway. The main effects reported in ibuprofen are related to the control of pain, fever, and acute inflammation by the inhibition of the synthesis of prostanoids by COX-1 and COX-2. Its adverse effect and contraindication: anaphylactoid reaction, risk of hyperkalemia, edema, hypersensitivity, including asthma to ibuprofen or other NSAIDs, history of gastrointestinal bleeding, perforation, or ulceration related to NSAIDs therapy. Next is the piroxicam. It is used for treatment of osteoarthritis and rheumatoid arthritis. The mechanism of action of piroxicam: the anti-inflammatory effect of piroxicam may result from the reversible inhibition of cyclooxygenase, causing the peripheral inhibition of prostaglandin synthesis. The prostaglandins are produced by an enzyme called COX-1. The piroxicam works by reducing hormones that cause inflammation and pain in the body. The piroxicam blocks the COX-1 enzyme, resulting into the disruption of production of prostaglandins. Its adverse effect and contraindication: medication, the new onset or exacerbation of hypertension, hyperkalemia, reversible female infertility, hypersensitivity including the history of asthma, bronchospasm, nasal polyps, rhinitis, or other allergic type reactions to piroxicam. As a summary of our report, an analgesic or painkiller is any member of the group of drugs that is used to achieve analgesia or the relief from pain. Analgesic drugs act in various ways on the peripheral and central nervous system. They are distinct from anesthetics, which temporarily affect and in some instances completely eliminate and sensation. Those mentions pain, some of them are preventable pain. So, to avoid in experiencing with those kind of pain, make sure to stay healthy, stay fit, and live a healthy lifestyle.